are a smaller hospital, so we're a community hospital located in southern Colorado. We have a population of around 10,000 individuals. We are now affiliated with a group called the Bridge Health Network, which basically affiliates 5 different hospitals in the southern Colorado region. You go out to rural America, you really see technology being a word of taboo. It honestly is. But my key element is how do we develop that train of thought of having them understand what technology is? Because technology isn't a taboo, technology isn't a problem. Technology is here to basically create efficiencies, help the physicians gain to where they need to be at moving forward. Collaboration is really key. I always look at collaboration, communication, which basically drives innovation. If you do not have support from top down, you will not be successful. And I always tell individuals is you really have to develop that overall story, that story of understanding why are we doing this? I'm not doing this to ruin your life. I'm not doing this to, turn your back away from the patients when you're basically documenting. And honestly, let physicians be physicians, that's the bottom line, and I do understand that. But the thing is we do have technology, and technology is here, and it's here to stay. And I mean all the new innovations happening with artificial intelligence, machine learning, the improvements of clinical documentation with the electronic medical record. These are all aspects to improve what? And that's patient care. As disruptors in healthcare IT, we need to make a difference. We need to start focusing on where are the standards? What can we do as an organization to collaborate with one another to create something that we can all speak the same language instead of so many different foreign languages that are basically in place? And that's a problem that we're faced with now. And I'm really looking very forward to helping at least try to drive some of those initiatives. It takes that collaboration, that proper communication of understanding. When we tell a physician, well, I'm going to start doing some clinical documentation improvements with you because your documentation doesn't meet the actual requirements for us to bill at a certain specific level. Looking at artificial intelligence, and honestly, very impressed of what IBM Watson is really doing on the oncology standpoint. It's not replacing a physician, it's basically creating a tool to help them create the most efficient care for that specific patient. So really looking at how do we bring these tools to improve your outcomes, to improve your efficiencies. Innovations really come out to what is needed of the organization. Where are we actually going as our mission and vision towards what we do? But we also have to incorporate different basic elements towards that actual voyage. When we look at innovation, sometimes we leave out the aspects of, well, what are we doing with cybersecurity? Are we basically incorporating that into our overall strategy? Okay, well, maybe we are. Maybe we're going to say that we're going to innovate more medical device technologies within the organization to improve physician efficiencies and improve patient outcomes. But did we know that there's 8,300 security software flaws in the pacemaker software alone? I mean, these are some elements that we got to look at too, is when we look at innovating, when we look at bringing these specific tools into the organization, you still need to incorporate the specific foundations of what is needed to basically get there. When I look at a vendor and I bring that vendor into the organization, that vendor concept changes to a business partner. I'm looking for business partners, not vendors, and that's the bottom line. But the thing is if you have an overall good business partner, their success is your success and your success is their success. That's my overall motto in regards to it. And if you can have them and allow you to drive initiatives, it's such a critical thing. I mean, we've done some amazing things with MedHost, which is our inpatient EMR system. We're hoping to be one of the first in the nation to have meaningful use stage 3, and we've attested a couple days ago too. So I mean, it's been an absolute amazing thing. And all these other awesome things that we've done, from most wired 3 years in a row to HIMSS stage 6. I mean, this all takes proper business partnership with our specific vendors that we have selected to be partners with us. Because like I said, my success is your success and their success is our success. And that's what we're basically looking at, is having that proper collaboration and that teamwork to make those initiatives basically happen.